Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're trying to work in with AI and find things that they say are fairly simple, and then they would start doing things like this. And this is one thing that I think any dentist should learn how to do, and that's when you get somebody in with an impacted or tilted, say in this case it's a wisdom tooth coming in, and you've got room for it, to learn how to upright that tooth and set it in there is not a difficult thing, and neither is ectopically erupting 6-year molars and stuff of this nature. Those are simple, easy things to do, and they're certain, almost surefire, something that you can do for anybody. So let's get through, go through this, and we'll show you that. Now, here's a young lady who had some more complicated stuff, and we'll go through that. She had a kind of a crowded situation, and to do it was a little more involved than just uprighting the teeth. But we did that and say, you got them lined up and everything, and these back teeth were coming in, and they could not make it completely. All right, watch. The upper ones came in all right. They usually can drop on down into the lower ones are the ones that gave trouble. So watch these lower teeth right in here, and then they come in. That's the wisdom tooth. We got it. They come up closer, and now we got this. Both of these teeth ran into the other tooth right here, and you got to pick that tooth up. And so what we do, and this is a simple procedure, you can take electrosurge and uncover just a little. You have to do this by working from on the side of the tooth. And now we'll come in and put a little place on this tooth. We put a tube on it, maybe it would be going, and you take an arch wire and you can make a little spring that you have something that comes in like this, and you can drop it down, come back up, and now you can run this down this way. Now you can take this, put it in this deal right here, and you come out here. This spring is like that, and this wire will be going over here. Now you have to bring that up and hook it to something so you can bond a piece of wire on these 3 teeth right here. You put a little bond in here, you put something back here. We would raise this wire up and put a little hook in it down here at the bottom, and now this come over and you come up, and you have a hook on that. Now that tightens this spring, and it'll push. It's like putting a bar in there and pulling this up, and you're going to swing this around, and it'll push this tooth back in like that. Same thing, we've drawn off over on the other side, the same identical thing. You bring this down to where it's working right on the side, and you may have to uncover the side, taking an electrosurge. You got to get to the side of the tooth, and you can upright it. Now let's watch and see what the next video here. All right, there this thing is. You can go in and load this, and this wire will go on down here, and there you bring it up, and you have these teeth bonded. You hook this wire right behind here. As this tooth comes out, this is going to slide this tooth back, this arch, the hook back, so it'll be coming under like this and have a hook over that. And you put it right behind one, and you've got a bond on this. And well, this is bonded here, and then it can slide that way. And let's see what happens here. So we took, this one came on in without any help over here, but here we had to do that. So we got this in, this loop is a simple, you have a deal come out, you bend it 90 degrees. And you take that, hook it in here, put a hook in it, and if you have something bonded like that, hook it right behind the bond. And as this tooth raises up, it's going to slide back. Let's see how this does now. Okay, there it is. And the hook is back behind one that's going to slide as that upright. And there it moved back like that. Now that is a simple procedure and should be done by anybody that has a little idea about how to do that. And you want to do that and get it up there when this tooth is coming down. You bring it in and it'll actually depress that tooth and work out where this is straight, coming through that way. Now this side over here, straighten it right out. And that's something that they say that would be easy for a general dentist to learn how to do that. So you learn these easier things, and then you come in and involve you in 2 or 3 other problems that you would have with a case, and you'll gradually work into learning it. See, I am a general dentist, and I've started out nearly 60 years ago working with this and doing easy, simple things, and just kept getting worse and harder stuff as long as we went, and it worked out fine for me. And you can do this for people as long as they live. You can do this type of thing. Let's go ahead and close up. And there, I want to show it. Here's the tooth. Now we took electrosurge, took the tissue off down here, showed it on the side. We built this little spring, then tied it off, put it in here, and then we'll cut the deal that holds it, and this wire will stay up, and then we bonded a wire to the teeth. And this bond, we put a hook in it, and we'll come over here and hook it over, something like that. And as the tooth straightens up, the wire will move back. You'll see this tooth now is coming up out of there. And there's the little deal. You put that, and I tied it, activated. You can come in and cut that wire after you get it in. In other words, this piece right here, if you put it in here, when you poke them in the gum, so you want to have the activation in here, and then you put your hook and all that, and then you cut this, and it keeps it from going down and poking the gum tissue there. So somebody came in with this problem, you could come back and fix that deal, and you can straighten up the impacted or wisdom tooth that way. And that's not a difficult thing to do, and pediatric dentists ought to know how to do this anyway. Use the same thing on ectopically erupting teeth, or where you've got a tooth that's coming in and it's tilted like that. You put it on the side and pull it up and keep some of that while you pull it together like that. So let's see how this came out. There's the retainer in. Now here was this tooth, and you get somebody that comes in late, and you come in and put that uprighting spring on that, and it'll correct that tooth right there. There we are. We reach in, and we hook it in here. This can slide back now. And there it is. It brought the tooth up in that way, and this slid from here to here. Pulled it out there, and you can put it back up against the other teeth as you get through. There it is again. Now it pulled it up, leveled it out, and that's something that every dentist should know how to do, something like that. Rather than throwing up your hands and extracting the tilted tooth or leaving it in there the rest of their life, that's the best way to do. So I thank you for watching this, and this is a simple procedure that really anybody should be able to learn how to do that. So I'm going to pass it out. I thank you for watching, and we'll go back and say hello to you again when you don't want you to leave our organization. And you learn how to do this, teach your fellow dentists around you how to do it also. Thanks for watching, and I'll say goodbye.